This patient went on to BV-AVD, and after 2 cycles of therapy, we did obtain an interim PET-CT. It's important to recognize that this is not designed to be a PET-directed therapy, and that at least at the time that the study was initially reported, we really didn't understand the importance of interim PET. Subsequently, it has been reported out that interim PET is predictive of outcome in patients with BV-AVD, and fortunately this patient did have an interim PET with a Deauville of 3, which supported continuing treatment through the full 6 cycles. This patient has now completed therapy and has achieved a complete remission. Patients that complete induction therapy for classical Hodgkin lymphoma that achieve a complete remission can expect to have a prolonged progression-free survival, and many of those patients will actually be cured. We know from a number of studies that have been conducted that having a negative interim PET is particularly important, and then again having that end-of-treatment PET show no evidence of disease is important. So I would say that this patient has a very high likelihood of being cured of their disease, and in fact when we look at long-term follow-up of patients treated for Hodgkin lymphoma, we find that after the first year to 18 months, that the most common cause of death for those patients is actually complications of treatment or other causes and not necessarily the Hodgkin lymphoma itself. For patients that complete induction therapy for classical Hodgkin lymphoma, most of them will ultimately be cured of their disease and will not require any additional treatment. However, if a patient were to relapse several years down the road or even several months down the road, we typically would consider evaluating that patient for an autologous stem cell transplant. This is typically accomplished first by completing aggressive salvage therapy, which is designed to reinduce a remission, and then moving forward with high-dose therapy and stem cell rescue. This can be a curative approach in up to 50% of patients, although that number can vary widely based on a number of factors, including the time to relapse. For a patient with advanced stage classical Hodgkin lymphoma, we now have a number of very good options for patients to receive. We have BV-AVD, which now has an FDA label in the frontline setting, and then we also have a very reasonable approach with PET-adapted therapy using ABVD with the possibility of de-escalating to AVD for a patient that's PET negative. I think it's very important for anyone that's treating a patient with classical Hodgkin lymphoma to truly take into consideration the patient and their particular comorbidities when making a treatment decision. I think it's also important to recognize that should you decide to proceed with a PET-adapted approach, that you be prepared to escalate to BIACOP should you find that the interim PET is positive. That's how we feel that strategy is most appropriately applied. In general, however, patients can be expected to do well, but it's very important to remember that there can be toxicities identified and that many of these patients are young people, and sometimes complications that are encountered during therapy can last for many years and can significantly alter the lifestyle for these patients. So it's very important to monitor them while they're on therapy and then in the months and years afterwards.